I am really excited today to be able to queue up what some folks may be looking for or excited about. I know I am at the very least, which is MPHA's 2025-2026 policy agenda. As mentioned before, my name is Alexis Walls, and I'm campaign director at the Mass Public Health Alliance. And so I'm really excited to have this moment with you all. What I'm going to be doing is I'm going to share some priority issue areas that MPHA is going to be working on in the next legislative session. And for right now, what we have are really principles that will guide our work in each of these areas, understanding that once the bill filing deadline comes in January of next year, we will actually add bill names and numbers. And so if folks are looking for that or excited, or you hear us share some of this and you wonder, wait a minute, where are the bill names? Where are the bill numbers? Those will come. They have not, bills have not been filed yet because we are coming towards the end of the 2023-2024 legislative session. And so that is something that you can look forward to in January. So for now, what you're going to be hearing are what are the priority issue areas MPHA is looking at and what are the principles guiding us in those areas. I want to flag for folks that you can actually follow along where you are calling in right now by simply going to the resources tab like you may have done earlier to look at the agenda. If you click on the resources tab and then you click over to the document section, you will actually be able to see the policy agenda, and so you'll be able to follow along with that. And so with that being said, I'll share a little bit more about how we actually arrive at our agenda as an organization and give you just a sneak peek behind closed doors and how we manage this process as an organization. And so one of the things we're really grateful for at the Alliance is that we get to partner with many wonderful people and organizations across the state. You all know, especially those who have been around in the MPHA network for a long time, you know that our team tends to be pretty small, which means in order to do effective statewide work, we have to be working in coalition and we have to be working with people across sectors. So we're breaking out of our silos and across regions and have geographic diversity as well in the work that we're doing. And so much of our policy work at MPHA is actually not just dictated by staff, but actually guided by what we call our Policy Council, which is a wonderful group of people who work across sectors and across regions in this state, who help us really think about issues that are impacting communities and what types of policies MPHA should be pursuing in order to address those while also doing the really important work of dismantling structural racism. And so what we do at the beginning of every summer before a new legislative session is we actually begin meeting with those council members one-to-one to get a better sense of what it is that they've been seeing on the ground in their communities, what their organizations are working on. We bring that group together as well through a policy council retreat where we all come together to discuss. We engage different partners who lead on issue areas that MPHA works on or maybe are interested in learning about based on what we're hearing from our policy council members. And then we come together as a policy council and then as a board to discuss these issues. And ultimately, our council makes a recommendation on our policy agenda. And so what you are seeing before you today is actually something that we have been working on for months now. And so we're really excited to share it with you. Some factors that we consider in all of our agendas at MPHA is that we really want to be uplifting policies and issues that address health inequities and dismantle structural racism, that are responsive to the needs and priorities that have been articulated to us by our community-based partners, that build upon and expand MPHA expertise, visibility, and opportunities for leadership. We also want to work on issues that enable strong cross-sector collaboration, that respond to windows of political opportunity, and that combine ambitious and long-term goals with meaningful short-term goals. And so those are some of the criteria that we keep in mind when we're thinking about what types of policies and what types of issues we should be working on as an organization. Now, when I present the agenda to you all, some of you might notice that some of these issues are somewhat familiar. And that is because, as an organization, there are some wins that we've seen from this most recent session. And that's something that you all heard Omi speak about. You heard Reggie speak about a bit as well during her talk. And then Omi and the commissioner also referenced that during their talk. But there are also issues and policies that we've worked on where there's still work that has to be done. And we as an organization want to remain committed to those things. And so you might notice that many of these issue areas are somewhat familiar, and that's for a reason. Alrighty. So again, I mentioned to you, you know where to find the agenda. I'm actually going to go to the next slide so that we can just sort of begin to lay out what it is that MPHA is going to be working on in this new section. And you can just see sort of an overview of the different issue areas that we're going to be working on. And I'm actually going to move us into the first one, which is public health infrastructure. You all have heard a lot about this today. In 2025, 2026, our organization will be advocating for strong governmental systems that provide services that prevent disease and illness and ensure safe communities, regardless of a person's race, income, or zip code. And so, again, this is one that you've heard a lot about today, especially in the conversation that we just got to witness between Omi and the commissioner. And so we will do a lot of work in the next year in implementing with our partners SAFE 2.0, and then also continuing the work around public health infrastructure to address overdose deaths. We can go on to the next slide. The next issue area that MPHA will continue to prioritize in 2025 to 2026 is housing justice, where we will advocate for inclusive communities where all residents can find safe, accessible, stable, affordable housing, and where residents who have been harmed by racist housing policies and practices have decision-making power. Now, this is a big policy area that is closely connected with health outcomes in Massachusetts. And our focus as an organization in the new legislative session will continue to be on keeping people housed and preventing displacement. This is an area of work where MPHA is not the primary holder of strategy. We organize very much in solidarity with some of the folks that you actually heard from earlier today on the panel with Janeska over at the grassroots community-based housing coalition, Homes for All Massachusetts. Our priority under housing justice this session will continue to be lifting the statewide ban on rent control and supporting efforts to build momentum around this movement in key municipalities like Worcester. We can move on to the next issue area, which is environmental justice. So in the new session, MPHA will be advocating for a climate policy that prevents and mitigates public health impacts of environmental racism, particularly in low-income communities, communities of color, and English as an additional language households. And so this is the second legislative session actually in a row that MPHA is naming environmental justice as a policy priority area. Similar to our housing work, this represents a slate of campaigns that is actually led or anchored by organizations that are closest to people on the ground who are most impacted by our environmental harms. Our priority in alignment with the Environmental Justice Table, which is the community-based coalition, the statewide coalition that we organize in solidarity with, will be around advancing policy that improves monitoring and mitigation of indoor and outdoor air pollution, as well as ensuring equitable implementation of energy infrastructure siting policy, which I'm actually very excited for you to hear more about from one of our partners in the next panel. We can move on to the next issue, which is equity through healthcare. So in the new legislative session, MPHA will be advocating for a healthcare system that leverages its power and resources to achieve health equity through legislation and regulation addressing health-related social needs and promoting equity in healthcare. So this area of work actually might be new to some, but if you have been in the MPHA orbit for a while, it might also sound familiar. And that is because this is something the MPHA has had a history of leadership on dating back to pre-pandemic years. This body of work captures the work that MPHA helps lead with the Alliance for Community Health and Integration, or otherwise known as ACHI, to address health-related social needs, leveraging mass health resources and our work with the Health Equity Compact to promote equity in healthcare. The next issue that is on the slate is transportation justice, where MPHA will be advocating for a well-integrated statewide public transit system that gets all residents, particularly people living within a regional transit authority service area, where they need to go. As you've heard from Omi earlier today, this is an area of work where MPHA, similar to in the local public health infrastructure work with SAFE, MPHA has experienced some success in this area of work in collaboration with our partners at Transportation for Massachusetts and the RTA Advocates Coalition. Much of our work in this area this year will be coordinating strategy to ensure that we maintain and actually increase investment for regional transit, which we've already seen the investments that have already taken place by our state leaders using fair share dollars has slowly but surely began increasing reliability in communities outside of the MBTA bus and subway service area. It's absolutely huge. Additionally, we will support efforts that are being led by partners in rural communities to promote the expansion of community-based demand response transit for folks who are currently underserved or completely unserved by larger transit systems in Massachusetts. We can move on to the next issue. MPHA will also be advocating for an equitable and resilient food system that ensures all communities have access to healthy, affordable food. This session, our work on food systems as an organization will actually prioritize closing gaps, recent gaps in state operating and capital funds for a food infrastructure program that MPHA helped to establish in 2018 called the Mass Food Trust Program, which provides loans and business assistance to food retailers who experience barriers to entry in low and middle income communities. We're also, as an organization, going to be supporting efforts that are led by our partners to expand eligibility for and enrollment in public benefits programs that support healthy food access. And then last but not least, we can go to this last slide, which is about additional fundamental building blocks of good health. MPHA will be following the lead of trusted partners to advance policies that promote community stability and health for all people, including people of color, immigrants, people who are poor, older adults, youth, LGBTQ plus people, women, people with disabilities, and others that are impacted by oppression. As you can see, there's a lot that we're paying close attention to going into the next session, but there are other critical movements impacting public health that our team may not have listed as a priority. So perhaps right now we're not putting a ton of our time towards it because others are leading in these areas, but our team is certainly committing to monitoring and growing our expertise by following the leads of experts in the field. And so I'll just name a couple of issues that currently for MPHA fall under this bucket, which include reproductive justice policies, trauma-informed violence prevention, and culturally and linguistically appropriate behavioral health supports, especially for youth and older adults. And so I will sort of close the rollout of the agenda there. What I've done today is, again, gone through and shared with you all what are the priority issue areas where MPHA is really going to be investing a lot of time and resources going into the next legislative session. If you all take a look at that policy agenda that is in the resources tab, you can actually follow along and you can actually see more detailed principles within each of these issue areas. And as I mentioned before, we will be adding bill names and numbers to this list once the new session begins. And so those will sort of go under the appropriate issue area where we currently have principles that describe the work. One thing I do want to note is just the need for us as an organization to be nimble. There is a lot that can happen within a short period of time, which we've just seen with the most recent election, where the political landscape can shift like that. And that might require something different from us as an organization. I mean, many of us did this at the height of the COVID-19 pandemic, right? There was a lot that we had to shift and pivot to do in our work to make sure that we're protecting programs and funding that is essential to the community's health. And so while this sort of gives you a snapshot on what MPHA will be prioritizing in the new session, I just want to name as well that we as an organization, it's incredibly important for us to remain nimble and to listen to what we're hearing from our partners. And so we're really excited to work with all of you, and just encourage you all to stay tuned to our newsletter so that you can hear more about how you can be taking action to support these issues as the new legislative session begins.